Welcome to Stop AIDS, Keep the Promise, a special on HIV/AIDS in Jamaica. For the next hour or so, we'll look at 5 critical areas in the Jamaican reality in the fight against HIV/AIDS pandemic. These are government policy, persons with disabilities, substance abusers, AIDS and the workplace, and we'll meet persons living with HIV/AIDS. Now, understanding the issues surrounding HIV/AIDS is as much your concern as it's mine, because if we're not infected, we are most certainly affected. Hi, I'm Fay Ellington, and I hope that by the end of the next hour, you will keep the promise. Stop AIDS. We'll be back after these.
Okay, so I have HIV/AIDS. But I'm a big man with a family. It's not just about me. How I can tell her this? She's not going to love me no more. I have to tell them. They're going to feel so shame. I can't tell them I have HIV/AIDS. These guys would never understand. She has the right to know it's her life too. I must explain to them clearly. They will understand. You know, it is all about me. If I don't have the courage to protect my loved ones, who will?
Brought to you by the Embassy of the United States, the Creative Production and Training Center, and Jamaica AIDS Support.
Welcome back. This entire program will be signed for the deaf. Well, did you know that if you have sex without a condom, you are at risk of getting HIV/AIDS? That's our factoid for this segment. In this segment, my guest is Chief Epidemiology and AIDS of the Ministry of Health, Dr. Peter Figueroa. In this segment, we look at prevention, testing, and treatment. And as we know, the saying goes, prevention is better than cure. What is the status of the prevention program in Jamaica?
Well, there's been tremendous progress with prevention, but much more needs to be done. And one of the most important things is that the majority of the estimated 22,000 persons living with HIV in Jamaica are not aware of their status. They do not know that they're HIV infected. So one of the most important messages we want to get out there for all sexually active persons is that you should get an HIV test and learn your status. If you're positive, you can get access to treatment, and if you're negative, you can practice safe sex to ensure you don't become infected.
Why do you think some persons just don't heed the warning of having a test done?
Well, one of the big problems we face is, unfortunately, there is still a significant stigma associated with HIV and AIDS, and we still have too many cases of discrimination against persons living with AIDS. And I think this is one of the things. People are fearful of doing a test and finding out that they are positive. But in fact, now there is the treatment available for persons who are positive. The care and support services are improving. There are networks of persons living with HIV who can provide support to people who need it.
Dr. Figueroa, how would you rate the Ministry of Health and the state's response to the HIV/AIDS pandemic in Jamaica on a scale of 1 to 10, with 10 being the highest? Where are we?
I don't like to rate a program for which I am responsible for. I think we've done a lot, but there's much more to be done. The government has a policy, a national policy, and this sets a framework for prevention, for treatment, for care and support, for mitigating the impact of the epidemic, for stigma reduction, as well as for an effective multi-sectoral response. And we are promoting sectoral policies. Ministry of Education already have a policy for the management of HIV/AIDS in schools, and they have been holding workshops with teachers, parents, students, rolling out that policy. And other ministries, Labour, National Security, local government, and tourism have all draft policies. So progress has been made, but there's a lot more work to be done.
It seems then that we are proactive, and in particular in the last year, we've kind of turned up the heat on this one.
Certainly.
How is HIV/AIDS affecting persons of middle age, persons in your age group and my age group, and in particular married women?
Well, what is interesting is that although certain people are more at risk for HIV infection, like if you participate in commercial sex, or if you use crack cocaine, or if you have multiple sexual partners, or if you have a history of other sexually transmitted infections, then you're more at risk of HIV infection. However, when we interview persons living with AIDS, we find that as many as 1 out of 4 persons living with AIDS have none of those risk factors. They do not fall into any so-called high-risk category. The only thing is that they are sexually active. And quite a number of women, some have had only one sexual partner, but they have become infected through the risk behavior of their spouse or partner. So this is why we say that anyone who is sexually active has to take responsibility for practicing safe sex. You should know your HIV status, and you should encourage your partner to also test for HIV, but you should continue to use a condom every time.
Can you see a married woman saying to her husband, please put on a condom? Pandemonium.
But Faye, that is why we have to say to all those married couples that they have to talk about HIV, they have to talk about the reality of AIDS, and they have to talk about condom use.
And the men have to be honest about this, because we do know that some of our men are philanderers and they have affairs. And you have to take care of not only yourself, but the people you claim you love. Let's talk a little bit more about testing. How expensive is it to do the test in Jamaica?
In the government service now, testing costs very little, just the registration fee. And in fact, we're discussing with the minister now to try and make HIV testing within the government service free of charge. This is something we hope to do. In the private sector, it will cost you maybe $1,000 or more to test for HIV. But the benefit of knowing your status, it means now we have the special test for CD4 counts if someone is positive. That is subsidized by government.
Is that this recently acquired viral load laboratory? Is that what that is used for?
The viral load is used to monitor someone who is on treatment, who has HIV, is getting treatment, and you want to be sure that the viral load is being reduced. But the CD4 count monitors the person's immune system, their body's defenses, because it helps to tell us when that person needs to go on antiretroviral treatment. And it also tells us that their immune system is improving when they're on treatment.
How long does it take to get the results?
Usually it takes about a week, maybe 2 weeks. It's fairly reasonable.
And all of the testing is done here in Jamaica?
It is now done here in Jamaica. It was not available before.
Is there any mandatory testing for any group in our society?
Well,
or is there anybody being tested and they don't know that they're being tested?
Well, everyone should be told that they are being tested. I mean, we routinely test pregnant women because we have the means to protect their baby.
And they know.
And they know, they're told beforehand. Also, persons attending STD clinics because they're more at risk. But there are certain groups. Clearly, anyone who is donating blood has to be tested in order to protect the blood supply. But persons who go for migrant labor work in North America, whether in the hotels or on the farms, those persons are routinely tested through the Ministry of Labor.
Speaking of testing, this perhaps is not a very comfortable point for you, but we must raise it. There have been in the past a few cases, 2 or 3, where persons have gone into a hospital, for instance, and have got blood that was positive, HIV positive, although it was labeled negative. What are your assurances and reassurances that we won't have a recurrence of this?
We've had a couple unfortunate cases where this has occurred, but on each occasion we've gone back and we have reviewed to make sure that the way in which the blood is tested and managed to ensure that these kind of mistakes are avoided in the future. Now, at the same time, there is what we call a window period where someone can donate blood and they have just very recently been infected and they are not yet producing the antibodies that give them a positive blood test. But this really now has been narrowed to maybe 1 out of maybe 500,000 or more, 1 out of 1,000,000 blood donations. So the risk is extremely small.
Very quickly, why do some persons choose not to be on treatment even though they're HIV positive?
I don't know again if it's fear or whether there's a problem of accessing the services, but certainly we want to encourage all persons who need treatment to come and get it. We have over 15 centers island-wide, all the main hospitals, main health centers, all the health centers in the parishes, parish capitals of the country. The treatment is available and we have support teams. So we've put on over 1,200 people on treatment just in the past year.
Are there any risks to taking any of the drugs, any side effects?
Virtually all drugs do have side effects. Sometimes it is just bad feelings. There's one of them that gives you vivid dreams, but it usually wears off. And then if you're on long-term management, we do have to look out for certain side effects, but usually we can manage those.
Thank you. Dr. Peter Figueroa, Chief Epidemiology and AIDS in the Ministry of Health. Well, let me just remind you that you have the right to hold the government to account to ensure that it keeps its promise and stays committed to the United Nations Millennium Development Goal, and it states to halt and begin the reversal of the spread of HIV/AIDS by 2015. That is, to halt and begin to reverse the spread of HIV/AIDS by 2015. When we come back, persons with disabilities and HIV/AIDS.
We all do things differently, but let's respect each other's right to worship as we please.
It is not for us to judge.
People who are HIV positive should be welcome in all our congregations.
You'd be surprised to know how easily it could be one of us if we are not careful.
You know the right thing.
So do it, share it.
Brought to you by the Embassy of the United States, the Creative Production and Training Center, and Jamaica AIDS Support.
Thank you for staying with us. Oh, by the way, did you know you can get HIV from a tattoo or body piercing? That is, if the needles are not properly sterilized or disinfected. There you have it. In this segment, we look at persons with disabilities and HIV/AIDS. And we have with us the Director of Programs, the Jamaica Society for the Blind, that's Conrad Harris. Then we have an outreach officer to the hearing impaired, or let me say it correctly, the deaf, at the Jamaica AIDS Support, that's Donovan Leslie, who himself is deaf. And the development officer at the Jamaica Association on Mental Retardation, Marilyn McCoy. Marilyn, I'm going to begin with you. How is the Jamaica Association on Mental Retardation raising awareness in your section of the disabled community on the whole business of HIV/AIDS?
Well, we as an association, as an organization, recognize that persons with disabilities need to know what is available out there. They need the information that they can be aware of what's happening in the arena. Now, the association is involved with a national project being sponsored by the European Commission and the United Nations Population Fund, which had undertaken a study, a baseline study, to look at sexual and reproductive health among persons with disabilities and their parents. Now, this study had a component in it that sought to get the knowledge, the attitudes, the practices of persons with disabilities as it relates to HIV/AIDS. The findings of the study had pointed out that there is a heightened awareness about HIV/AIDS, although the knowledge is quite deficient.
Well, let me bring Conrad in. Conrad, what is the blind community's response to the HIV/AIDS pandemic?
Okay, there has been, well, we are part of the general population, and as a result, there have been blind persons who, are infected with HIV/AIDS, right? And as a result, there's an increase in the amount of level of discussion on this topic. The Society for the Blind is a part of the project that Marilyn just spoke about. But in addition, there's a greater level of discussion, communication on HIV/AIDS in our population. One of the issues that happens, though, is that the material, information, is not really available in accessible formats. So for example, you don't have a lot of material in Braille or maybe on cassette as well. So there's a deficiency there.
We're going to get back to that in just a while. Thank you, Conrad. Donovan, and I'm going through my signer now, my interpreter for this one. How aware are deaf people, the deaf people with whom you come in contact, about HIV/AIDS?
Yes, some people hear about AIDS. Some of my friends in the community, maybe about 18 persons in the community have AIDS, and I am surprised 18 people in the community have AIDS, because some people really don't go to the doctors, some don't go to the clinic, but some go to the clinic and they find out that they have AIDS. At my workplace, at the Jamaica AIDS Support, really there at my workplace, I try to reach out to the deaf community and to encourage them to go and get tests. I also carry video for the deaf person to watch, and I teach them about AIDS and the effect, and I encourage them, say, to come to my workplace and get tested. You can come and you can get tested free. And some of them come. I also try to encourage hearing people, but most people don't want to come there because of the stigma that is attached to it. It's the Jamaica AIDS Support, and they really don't want to come there. But I really try to counsel them, and I try to work with them, and I try to get a nurse who has a little signing skills to help them.
Okay. Tell him to hold it for a while. Thank you very much. Marilyn, that's interesting what we're hearing from Donovan. But what are the special challenges that you see facing those persons with mental retardation when we speak about HIV/AIDS?
Okay, when we talk about persons with mental retardation, first of all, you need to know that one of the characteristics of persons with mental retardation is that they have low or limited academic functioning levels, which means that many of them have low self-esteem, many have problems or difficulties establishing interpersonal relationships. Now, all these factors will have a part to play as it relates to increasing the awareness as it relates to HIV. Now, persons with mental retardation have difficulties as it relates to information that's out there. The information is not accessible to them. Because of their academic attainment, they are not able to understand the reading levels, especially of those materials. So what we have been doing is try, in our sex education classes and so on, we have been sending the information to the persons in adapted format, visual format, making them understand what the information on the brochures and so on are saying.
Some men participate in very sick behavior and prey on mentally retarded women. How prevalent is this?
It is very prevalent, Faye. Persons with mental retardation are vulnerable because of their disability to sexual abuse and exploitation. Many feel that, and it is a fact that many of the abuses go unreported because these persons are not able to explain what happened to them and to pass the information on to other persons who would make a difference.
Do you have any statistics about persons in the with mental retardation, whether or not they are HIV/AIDS or positive or have AIDS?
We know of persons within our community. We don't have official statistics, but we are aware of maybe 2-3 persons who have been infected with HIV.
Conrad, let me bring you back into the discussion. Is there a similar problem that Marilyn spoke of in the blind community, where the women in particular are preyed on?
Yes, Fay. One of the problems is that persons who are blind sometimes can have difficulty establishing relationship because of the stigma associated with blindness. And sometimes persons who are blind, especially women, they will put up with a situation which maybe other persons might not put up with. And so they are sometimes more vulnerable than other persons.
Has the blind community been lacking in vision in terms of its response to HIV/AIDS? Is this a fair criticism? I've heard it.
Well, I don't think, I personally don't think that the blind community is doing as much as could be done, right? But I believe that people are the general national campaign, blind persons benefit from it. I believe there's an increased awareness, and as I said, there's a greater willingness to discuss this matter among persons who are blind.
Would you like to have much more of the material on Braille, and is it just your responsibility, or should it also be the responsibility of the government to get it on Braille?
Well, I do believe that any national campaign should target all nationals, including persons who are disabled, persons who are blind. And therefore, I believe that if you have a national campaign dealing with HIV/AIDS, then it should also include persons who are blind.
Okay.
At the same time, as the Blind Society, we also have a responsibility to try and make that happen.
Donovan, using mobile phones to text has assisted the deaf community tremendously with communication. To what extent is texting used to pass on information on HIV/AIDS?
Okay, suppose the deaf go and get tested. 2 weeks pass, the nurse can text the person to say, fine, yes, the deaf person will leave the number. The nurse can text the person to say, no, your result is ready, you can come in for your result.
Thank you. It's amazing, those of us who are not deaf don't understand that texting is not just something that teenagers do, but it plays a vital part in the communication process of the deaf community. I want this to be done very quickly now. I'm beginning with you, Marilyn. If there's one thing that you wouldn't want to leave this program without sharing with those persons watching this program, what would it be as it relates to your community, the mental retardation persons?
I would really want the general public to understand the limitations of this population, and to understand that sometimes the information out there is accessible to the general public, but not to this particular group, because there is a wealth of information out there, but our persons cannot understand or grasp what is being transmitted. So we really need to adapt or to modify some of the information that's out there on HIV/AIDS to make it more accessible to our part.
Donovan, short answer. What would you like the viewers on this program to know? One thing that is important for them to know about the deaf community and HIV/AIDS.
Deaf, we can help by creating videos and different things and provide sign language information in sign language so that deaf people can access it. Sometimes we become very frustrated when we can't understand the written language, but if sign language is provided to give information about AIDS and to the deaf community.
Thanks, Donovan. And Conrad, what's the one thing you'd like to leave?
Okay, and there are persons who are blind persons who sometimes are dependent on other persons for mobility and for other things. And I would say to those, ensure that persons who you are close to get tested because AIDS can be treated.
Thank you so much. My guests in this segment, Marilyn McCoy, Donovan Leslie, and Conrad Harris. And Stop AIDS. Please make a promise. Let's ensure that the relevant agencies serving the disabled community are empowered to serve their members. After this break, we'll discuss the substance abuser and HIV/AIDS and AIDS and the workplace.
I see differently.
I am mobile.
I think a little more slowly than you do.
Yes, parts of our body are different to yours, but our heart, our soul, and certainly our spirit is fully intact. Even though there are disabled persons living with HIV/AIDS, still we dream and we love, and just like you, we want to live and be safe.
Brought to you by the Embassy of the United States, the Creative Production and Training Center, and Jamaica AIDS Support.
Welcome back to this 1-hour special on HIV/AIDS. I am Fay Ellington, and in this segment, here's the factoid. Did you know that in 2004, adolescent females in the age group 10 to 19 years had 3 times higher risk of HIV infection than boys of the same age group? This is as a result of social factors whereby young girls are having sexual relations with HIV-infected older men. On the average, 50% of young women reported their sexual partner to be 5 to 10 years older than them. Coming up, persons living with HIV/AIDS, but first a discussion on HIV/AIDS and the substance abuser and AIDS at the workplace. For this segment, I'm joined by Dr. Winston Delahaye, lecturer and consultant psychiatrist, and Human Resource Manager of Manpower and Maintenance Services Limited, Monica Young. Might I add, we are using their auditorium to record this program. Dr. Delahaye, substance abuse and HIV/AIDS are a deadly duo.
Absolutely.
What's the trend in Jamaica?
Well, we're seeing the same kind of trend that's seen internationally. So it's been known that substance abusers, but more specifically intravenous drug users, are more at risk of acquiring HIV/AIDS. In Jamaica, it's the crack cocaine abusers who have been found to be at risk. My own research at the University of the West Indies shows female substance abusers, more specifically crack cocaine users, to have a prevalence of 12% compared to the population norm of about just under 2%. So they're significantly more at risk for acquiring HIV/AIDS, and for men, they had a prevalence of 4%.
Well, the women seem to have an additional problem too, because if they're a substance abuser and they're HIV positive, I know for a fact that we don't have the same amount of treatment facilities that we have for the men who are substance abusers.
But we actually have none other than the detoxification unit at University Hospital of the West Indies, which is a short-term 2-week program. There is no existing substance abuse treatment facility, rehabilitation facility for female substance abusers, which is a big issue in this country.
When they come into the detox unit at at the University of the West Indies, do you mandatorily test them for HIV status?
That's a routine part of the intake. We're the only facility where routinely substance abusers presenting for voluntary admission are tested for HIV/AIDS.
The street children seem to pose a particular problem as well, because as young as 9, 10, some of them are abusing drugs, and they are getting involved in really promiscuous sexual behavior. Do you have any information on that you could share with us?
Well, similarly, we have one of the only clinics for adolescents who have substance abuse problems at the University of the West Indies. And we are actually seeing a range of as early as 7 to about 16 in terms of age of onset of drug abuse, which is alarming. And in fact, this age range, it peaks at about 12, 13. And so the reality is that youngsters are starting to use more early. The earlier one uses, the more likely you are to be exposed to a network member who is HIV positive to progress to using other substances and acquiring HIV/AIDS.
My Lord, this is frightening, and it's trending in a very frightening direction. Monica, it is not very difficult to see that the workplace has some relatively new and perhaps difficult challenges as they relate to HIV-positive employees. What are some of these that you've experienced as the Human Resource Manager with Manpower and Maintenance Services Limited?
Well, Faye, we have over 1,200 workers in our employ. So the issue of HIV/AIDS is something that we have dealt with and continue to deal with. Some of the challenges we face, we see increased absenteeism, inconvenience of the other colleagues. We see a disruption of the workflow. And of course, put a burden on our supervisory capabilities at times.
But do these people come forward and confide in you that their status is that they're HIV positive or they have illnesses that are associated with AIDS?
Not readily. What we tend to notice sometimes, it's that the workers' output may fall. The absenteeism increases. They are withdrawn. They get irritable. And so when these signs happen, we usually try to, see if we can find out the cause. And sometimes it's HIV/AIDS.
How do you deal with the stigma and discrimination? Because employees gossip, they talk, I think so-and-so is HIV positive, and they don't want to sit next to them or work. What do you do?
Well, from experience, and we notice that, yes, at first, before it is known, before the worker comes forward and admits, there is a level of discrimination. However, if it is known at a particular location, then we try to sensitize their colleagues, and they usually support them in the end. You find that they, having learned that, you really can't catch this thing now, they provide support. What we have to deal with, though, is that all of these persons, they live together, same communities, and then the information may get out there too.
So you're dealing with not just a workplace scenario, but it goes into the wider community. And you have to deal also with family and friends.
Yes, we have to deal with family. We have had to deal with children of workers, provide some kind of support for them as well. The mothers get ill, they can't take care of them, they come here, it's the only place they know to come. They come to the company and we try to provide some sort of support.
Manpower and Maintenance Services Limited seems to be very proactive where this matter is concerned. You are a human resource person. When you talk with other human resource managers, are their companies as proactive as you are?
Yes, they are, and of course we share information, and so we try to make the workplace as comfortable as possible for the workers who are, as long as they come forward, as I said. And one of the other challenges we face is that they don't come forward as quickly as they should. And so it's only when we start seeing the signs that we really try to intervene.
And when you say the signs, what are you making reference to?
As I said, there's a particular issue that I can relate to where we had this worker and the supervisor complained constantly. She's just irritable. Every time you speak to her, she just gets upset and all of that. And when we spoke to her, when we called her in and spoke to her, she was just angry because she just found out that she was HIV positive, and so that was the only way she knew of dealing with it.
Of course, not every irritable person is HIV positive, so please bear that in mind. Dr. Delahaye, when we speak of the workplace, it is normal to think of an institution, a factory, an office, but we must also discuss the work environment of the commercial sex worker. Absolutely. Prostitutes. What information is there on the commercial sex worker and substance abuse and HIV/AIDS?
Well, this certainly poses a major problem for us. Commercial sex workers are a known risk population for acquisition and, more importantly, transmission of HIV/AIDS. The reality is women have a higher rate, based on the figures I quoted to you earlier, of HIV/AIDS in the substance abuse population studied at the University of the Hospital of the West Indies by virtue of the means by which they procure funds to support using substances. And so most of these women in the study we looked at over the 12-year period were in fact commercial sex workers. We've had recent, relatively early discussions with the Ministry of Health looking at how to address this issue, because in addition to Jamaica having no other long-term rehabilitation facility for women, women leaving the detoxification unit having been identified as positive rarely continue to come to our clinics. And so we're seeing them, identifying those who come, and then they're
and
gone.
we lose them.
That's right.
And they're perhaps gone on to carry on their jobs of a commercial sex worker.
Absolutely.
Oh my Lord.
It's a big problem.
From where you sit, what do you think will happen to this nation in another 5 or 10 years where HIV/AIDS is concerned?
It's no doubt a big challenge. As Dr. Figueroa pointed out, we're making some strides, some improvement, but we need to be more focused probably in the areas where clearly there's a high risk, for example, commercial sex work.
And some men still believe that the best way to initiate their sons sexually is to let them loose on a prostitute.
I would hope that has changed. Certainly would hope so.
Oh my God. Monica, what would you say the persons who in positions such as you, the human resource person, the employers, the persons who run companies, need to do to really get to the heart of this so that people can feel comfortable to share with them and that their confidence will be kept? Because this is another issue, you know. They are afraid that the manager going to talk or the supervisor going to talk.
Yes. Well, first of all, Fay, you know, we are bound by the confidentiality issue of employment. So of such, when the worker comes in and share their status with us, then it is kept confidential. Not even the client that we are contracted to knows. So what we have to do is really, we have to go there and we have to speak to them and let them know that they need to feel safe to come in and share their status with us and that it is kept confidential. Then we have to just treat them like normal workers.
What if you are hiring and somebody says to you that I'm HIV positive, would you hire?
Yes, we would. What we do, and we would love if they would, because what happens then is that we will place them in suitable areas to work. Because of course we recognize that there are days when you're not well enough to work, and so there are areas that are, you know, much harder than others, and we will place you there. So we definitely do not discriminate.
Do you end up having to pay for some of the treatment for some of your employees?
Yes, we do. We are committed to taking care of medication costs to the doctors. They come in and we have a facility at the hospitals. So they go and they bill us and we pay. We are committed to doing that. We have and we continue to do it.
Now, this is commendable. I don't know. You said that you thought that many other companies are operating like this, but I don't know. You think that?
Yes, I think so. I've had meetings with other HR persons, and they are doing the same thing.
Dr. Winston Delahaye, I'm going to give you the last 30 seconds.
Well, I'd close in saying use of any mood-altering substance puts you at risk for acquiring HIV/AIDS.
And that includes alcoholic beverages if you do it in excess.
You don't have to be addicted. Use of any mood-altering substance can lead you to engaging in risky sexual behavior.
Glue, alcoholic beverages, anything like that, that will make you lose your control over yourself. Then you don't know what happened after that.
That's right.
Thank you so very much, Dr. Winston Delahaye and Monica Young. That was really very good. Thank you. And if we are to stop AIDS, then you need to practice responsible sexual behavior. That's one way to show the people you say you love that you really do. I'm sure you want to be alive and around for them. When we come back, persons living with HIV/AIDS.
I watch this country change. One time we always respect our seniors and take care of them. The whole community would rally round, especially if them sick. Now nobody no care about old people. Look what we come to.
We work hard all we life. We make enough sacrifice for the children and the community. But nobody no care. Worse when they hear we have HIV/AIDS.
Them think it's only spring chicken get them things, you know.
But now we need family and community support more than ever. Don't put us out to pasture.
Brought to you by the Embassy of the United States, the Creative Production and Training Center, and Jamaica AIDS Support.
Welcome back to the final segment of Stop AIDS, Keep the Promise. In this segment, it'll be people living with HIV/AIDS. But our factoid for this segment is, did you know, and listen to this carefully, did you know that HIV/AIDS and sexually transmitted infections are the second leading cause of death for both men and women in the age group 30 to 34 years in Jamaica? Okay. You need to think on these things. I'd like to thank most sincerely Anisha Taylor, an outreach officer with the Ministry of Health, and Ainsley Reed, program officer of the Caribbean Conference of Churches and co-founder of the Jamaica Network for People Living with HIV/AIDS, for joining me in this segment. You're both living with HIV/AIDS. Thank you so much for being courageous to come and talk about it. Ainsley, you've been positive for 13 years. What has that journey been like?
Well, it has been a journey of mixed fortune for a number of reasons. One, I've had the experience of being stigmatized and discriminated against, being asked to leave my job and stuff like that. In addition, one of the most profound blessings in living with this virus is accessing treatment. And so I've been glad to tell you that my viral load today is 50, and my CD4 cells just recently was 759.
All right. For the uninitiated, is this good, bad, or indifferent? From the smile on your face, it says it's good.
Of course. My CD4 cells speak to the strength of my immune system, as Dr. Peter Figueroa said earlier. My CD4 really was at 99 4 years ago, 3-4 years ago. So to have a a set of CD4 cells moving from 99 to 759 speaks to some level of strength in my immune system. My viral load, which is, you want to make sure that as a person living with this, you have a small number of virus in your system. And so my viral load has been, you know, it has moved from 1-point-something million to 50. And that for me is an achievement in my own.
I just want to thank
health
God
management.
for that.
Yes, right.
Let me bring Anisha in. Anisha, you were diagnosed in 2003. How are you coping?
Still being stigmatized, and not too bad. Most of the time I cry.
How did your family or your close friends deal with it? Did you find it easy to share it with them?
With my mom, because my mom has always been there for me through thick and thin. And my friends, some of them have forsaken me. My father's sets of family, they don't much come around me.
But you are an outreach officer with the Ministry of Health, and that is good news. At least you have a job.
Yes.
How long you've been doing that?
Well, it's around 5 months now.
What do you do?
I go to the nightclubs and I talk to them, telling them about the risk, about HIV, about STIs, tell them how they can get it, how they can prevent it. And trust me,
You're speaking to the go-go dancers?
Yes, I do. They are not go-go dancers.
What are they? Sorry. They're exotic dancers?
Exotic dancers.
Beg your pardon.
And commercial sex workers.
So what is it to you? When you sit down and share the information you have with them, how do they respond to what you have to say?
Sometimes I have to bring out myself in the spotlight for them to hear me more clearly. Sometimes they said, well, what you talk about, me not do it, you know. Just I do one thing. But you have to come to them plain and straight, and you have to talk, you have to speak their language.
Anisha, them using condom?
Yes, they do. But they don't know how to put it on properly.
Lord, is it not working properly then?
Yes, it is. Because when I go to Freaky Night, I show them, and then They will
Freaky night?
Yes.
At some of the clubs. I can
At some of
imagine
the
what
clubs.
happens, almighty gyro. So you show them at the club while they
Yeah.
are carrying on how to put on.
No,
so what
I
about,
talked to them before.
Before?
Yeah.
So what about the patrons in the club? Do you speak with them as well, or is just the ladies who work in the
No,
clubs?
we speak to the patrons, we speak to the gatekeeper, we speak to the bartender as much
You
much
have
people
a
as
very responsible job, and I have to thank you, because somebody needs to do this. Ainsley, have you had to deal with discrimination and stigma in your job as program officer with the Caribbean Conference of Churches?
My job required that I travel a lot. So I travel, my area is Haiti, Dominican Republic, Bahamas, Jamaica, and Belize. So I do quite an amount of traveling. One of the experience I've had, and you know, because of my traveling, I have to have a visa. And my visa to some of the islands, some of the countries that I have to travel, really say that I'm a criminal.
What?
Yes, my visa to one specific country say that you can visit, but you are a threat to the country, and you are a criminal. You have a criminal record. I have never done anything that require me to stay in prison or anything.
So how do they arrive at that?
Well, I think it has to do with the laws of the country.
Do you have to divulge your HIV status when you apply for these visas?
Yes, right.
Oh,
I have to say to the consulars that I am HIV positive, and you know, I'm given in some cases I'm given a waiver to travel to some of these countries.
I'm sorry, you've hit the wind out of me with that one. Let me try to get back on track. Some persons see that the church is also a problem with regards to the spread of HIV/AIDS because certain denominations do not support the use of condoms. How do you see it?
As a person living with AIDS, I'm married.
And you got married after you were diagnosed?
I got married in 1999. Of course, I use a condom with every act of sex with my wife. And, you know, that is an important thing for us. I think, though, that churches are just like other agencies. They are going through a phase of, you know, talking about this issue. Because HIV/AIDS is a big, we should not take it at face value. It raises other questions that are very deep and cause passion, cause war, cause trouble, and cause conflicts too. Now, I think that in some congregations, there might be some specific position on the use of condoms. I, however, think that the response to HIV/AIDS should not just be a church issue. It should be a personal issue. And if I'm in a particular church and my wife is not HIV positive, I need to ensure that I'm protecting my wife, because not using a condom will not protect her.
You've come public with your status. Is your wife stigmatized or discriminated against because you've come forward?
I think she has had experiences in the past where she has been stigmatized. However, I think she's a brave woman, and I must take this opportunity to publicly commend my wife for the kind of person that she is and for the strength and support that she has shown me over the past number of years.
Anisha, what do you fear most? You are HIV positive, you are diagnosed in 2003. What do you worry about most?
I'm worried about my children. For me to go public, I try as much as possible to let the public know that I'm positive. I don't attend parents-teachers meeting. I keep as far away from my children as much as possible.
You keep away from your children?
Yes.
At the school, do they live with you?
They live with me.
But you don't want to be seen around them in
No.
their school environment?
No.
Why?
Because I fear people will move their children from the school, or they will show my children bad face.
Do the teachers know?
At one school that my big daughter was going, her teacher knew because she told her, and I moved her away from that school.
Ainsley, that's a real problem. How can persons living with HIV/AIDS help others in our response to you?
I think as a country we have come a long way. I think we have come a long way because many more persons living with HIV/AIDS are coming forward in various forums. Some in communities, some in their own institutions where they work and stuff like that. I think over the years we have seen the coming together of people living with AIDS, not only in Jamaica but around the world. We now have representation from Jamaica at the level of the Caribbean Regional Network of People Living with AIDS and at the Global Network of People Living with AIDS. And we meet almost every 2 years. In the Caribbean, we meet every year. So there are some movements. I however think that more people living with HIV/AIDS need to come forward and find support and to realize that not everybody will chop you up and beat you up, but there are people who are willing to provide the kind of support for us to have a good quality of life in our community.
We have about a minute left in this segment. Anisha, what's the worst thing that anybody did to you or said to you or about you because you disclosed your HIV/AIDS, your HIV positive status?
Was to tell me that I'm a walking dead.
To tell you that you are a walking dead. Ainsley, what was the worst thing that anybody ever said or did to you?
I was stabbed up in half a tree. I was stabbed up in my neck, in my chest, and in my back. I was almost left to die. I was taken to KPH, where I experienced stigma and discrimination in the hospital setting.
Thank you so much for being so brave, both of you, Ainsley and Anisha. My guests in this final segment, Stop AIDS, Keep the Promise, and at least we can try to be civil and kind and treat people the way we would like to be treated. Anisha Taylor and Ainsley Reid, thank you so very much. My sincere thanks to the U.S. Embassy's Office of Public Affairs for making this program possible and to the team working on this program. I'm Fay Ellington. This has been a special one-hour program on HIV/AIDS in Jamaica. Let's keep the promise. Stop AIDS. Do your part, will you?